Hi, my name is Dr. Abafami, and welcome to this short video series on diagnosing and managing syphilis.
Hi, I'm Dr. Rowan, and I'll be joining Dr. Abafami to talk with you today about syphilis.
We see a lot of syphilis in our STI clinic, but for many providers, it is a new and somewhat perplexing infection. We created this series to help guide providers who work in any type of healthcare setting, primary care, urgent care, emergency departments, or even private practice, understand the key elements required to diagnose and manage syphilis properly. In this video series, we will review essential aspects of syphilis screening, diagnosis, and treatment so you can effectively care for your patients. This video was created by the Denver Prevention Training Center and the National Network of STI Clinical Prevention Training Centers in partnership with the Denver Sexual Health Clinic. Let's begin with a few basics. Syphilis is an infection caused by the bacteria Treponema pallidum. In 2023, there were 209,253 cases of syphilis in the US, which is the greatest number of syphilis cases reported since 1950. And an increase of 1% since 2022. This continued an upward trend since 2018. Syphilis disproportionately affects gay and bisexual men who have sex with men, accounting for 45% of cases. However, cases among heterosexuals, particularly women, have also increased, leading to a parallel rise in congenital syphilis. In 2023, there were 3,882 cases of congenital syphilis in the US. This was a 3% increase compared to 2022. We can prevent congenital syphilis with proper screening and treatment during pregnancy. Remember, anyone can have a syphilis infection, and it is essential to screen all sexually active people for syphilis.
So let's talk about screening. Who should we screen for syphilis? Well, in high priority areas like emergency departments, urgent cares, jails, or clinics in high prevalence areas, geographic-based screening is a great strategy. Geographic-based screening means offering a syphilis test to all sexually active adults aged 15 to 44 without prior ascertainment of risk factors. In regions where the prevalence of syphilis is more than 4.6 per 100,000 women, geographic-based screening is recommended. Risk-based screening, on the other hand, involves asking the patient about their risk factors for syphilis and then using that information to determine who should be offered a test. Risk-based screening is important in lower prevalence areas and for people outside of that 15 to 44 age group. It's also important to remember that ascertainment of risks in terms of the patient's sexual history is critical for determining which patients need to be re-screened and at what intervals. So, who should be screened for syphilis? The following factors are associated with increased risk for syphilis and can be used to determine who should be offered syphilis testing. These include history of substance use, prior STIs, incarceration, transactional sex, or multiple sex partners.
Here are the current CDC recommendations for testing asymptomatic people for syphilis. All pregnant patients at the first prenatal care visit or at the time of the first positive pregnancy test. Retest again at 28 weeks and again at delivery. For all women, test all at increased risk. For men who have sex with women, test all at increased risk. For gay, bisexual, and other men who have sex with men, screen at least annually and more frequently every 3 to 6 months if at increased risk. You might be hearing a common theme, at increased risk. What this means is that as providers, we must ask questions about patient sexual history to better understand some behaviors that might increase the chances of being exposed to syphilis. You can see these factors here, here, and here. And in our next short video, we'll discuss how providers conduct a short sexual health assessment and a good medical history to better understand whether a person might be at increased risk for syphilis. Both are key for deciding who to screen, and more importantly, are essential in your ability to diagnose syphilis.
Let's do a knowledge check. Question 1. In areas with high rates of syphilis, what screening approach is recommended for sexually active individuals aged 15 through 44? Is it A, risk-based screening only, B, geographic screening, C, no screening is needed, or D, both risk-based screening and geographic screening? The answer is D, both risk-based screening and geographic screening. We know that in high prevalence areas, it is appropriate to offer a syphilis test to all individuals age 15 through 44. It's also important to understand the risk factors for syphilis to determine the appropriate interval for rescreening.
This approach involves offering syphilis screening to all sexually active people aged 15 to 44 in areas where the rate of primary and secondary syphilis is higher than 4.6 per 100,000 people. This strategy normalizes syphilis testing without requiring a detailed sexual history before offering the test. Question 2. True or false? Individual risk-based screening is unnecessary in areas with high syphilis prevalence. The answer is false. While geographic screening is recommended in high prevalence areas, individual risk-based screening is still necessary, especially in lower prevalence areas or for individuals outside that 15 to 44 age range. Clinicians should consider the prevalence of infection in their communities, as well as socio-demographic and behavioral factors associated with the increased risk of syphilis infection. If you got all the questions correct, excellent job. If you missed a question, don't be discouraged. We recommend reviewing the video again or the resources below for better understanding. Learning is a journey, so keep exploring. Thank you for joining us for comprehensive diagnostic assessment for syphilis, tests, staging, and best practices. I hope you join us for the entire video series. In upcoming videos, we will cover essential aspects of diagnostic testing, clinical assessments, treatment, prevention strategies, and important resources and more. Let's start learning together.